we have to do a better job of taking care of our respiratory system. So it's a very intimate system, and it's all connected to the marriage of East and West medicine is where we're at right now. 80% of all infections and other nastiness comes into the body through your
healing secrets, the secrets of herbal healing with Brett Elliott.
Welcome back to another episode of Secrets of Herbal Healing. And today we're interviewing a friend of mine that I met years ago when she was visiting New Zealand, and she had tried our detox program. Her name is Dr. Gail Lebovic, and she's a serial entrepreneur. She's got over 50 patents for medical devices, and she specializes in she has specialized in surgery for breast cancer for women, and over the years has developed many devices to help alleviate the stress and pain of dealing with surgery and with breast cancer and various other things related to that. So it's a real privilege to have Gail on the show. We're going to talk to her about her journey into surgery, into the profession, into making the medical devices, and also what she's learned about the connections between lung cancer, heart disease, and breast cancer, or lung health, heart disease, and breast cancer. So it's going to be a very interesting discussion with Gail. So we're very excited to have her on the show. Welcome along, Gail. Thanks for joining us. It's a pleasure to have you on the show.
Thanks so much for having me, Brett. It's an honor, really, and certainly a pleasure to talk to you.
It's also a pleasure to talk to you. It's we met 15 years or more ago in Auckland.
It's crazy. Yeah. Time flies when you're having a good time.
Yeah. You've been back to New Zealand since, I gather.
Yeah, I live there part-time, actually. So I go back every year. I try to do summer.
Okay.
I follow the sun.
Okay. So you've got a place in Auckland now?
I do. A small little postage stamp.
Oh, great. So New Zealand's the holiday home.
Yeah. Hopefully one day, maybe my home.
Oh, great. Yeah, we'd love to have you.
I would love that to happen.
All right. So let's tell us a bit about your journey, because I'd love to hear how you got into medicine in the beginning. What's the family history behind that? And a bit of the background. I understand that there was a cancer journey that sort of got you into that side of things as well. So tell us about that.
Oh, it's a long story, but in the interest of time, I'll give you the cliff notes.
Sure.
Do you have cliff notes in New Zealand?
Bullet points, I think we go by. Yeah. Similar.
Anyway, my parents actually immigrated from Czechoslovakia to the United States. So very humble beginnings. They came here. They didn't know the language. They, had to go to night school and support themselves during the day by working literally in sweatshops. So, as I said, very, very humble beginnings. And there was a family that had helped them move to America who really helped them a lot, as well as my dad's aunt. So it's really a great story in and of itself. Truly the American dream type story.
Yeah.
And then the woman, Sally Rosenberg was her name. She ultimately got breast cancer. There were a couple of people close to our family who had breast cancer and died, prematurely, I would say, because back in the 70s and 80s, certainly the treatment options weren't as good. The detection was late. And so the disease was more advanced. Anyway, we lost a couple of people before their time, and that really impacted me in my youth growing up. And so it inspired me to go into medicine, as well as my own injuries. I had a number of injuries from gymnastics, mainly on my knee, and was inspired by my orthopedic surgeon, who was amazing. So I went on a journey to become a doctor. No one in my family had really ever been to college, even, other than my cousin, who is a decade or so older than I am, he did go into medicine, and that was also inspiring. So all of those things added up, and I went along my lifetime journey of becoming a physician and being in healthcare.
Right. And you got into surgery fairly early on. Was that the specialty that you went into right away, or is that something that happened later on?
Well, it was really challenging at the time because, believe it or not, and I guess it's still a little bit this way, surgery is a man's field, quote unquote. And I was told that by the dean of my medical school. I majored in anatomy and physiology as an undergraduate at Berkeley and absolutely loved the power and the strength of the human body. And the more I learned, the more I wanted to know about it. I became fascinated with anatomy. I got a graduate degree in endocrinology and then ultimately went to medical school. And the rotation I loved the most by far was surgery because
Uh,
people came in with a problem and then we fixed it. And it
right.
was just fascinating. It was really meant for me. But when I told the dean I wanted to go into surgery, he said to me, "Well, you can't do that. That's a man's field." I was
Okay.
like, looking back on that, like
Yeah.
today, that would be crazy.
Yeah.
But ultimately, I am very glad I pursued my career in surgery because it really was meant for me, or I was meant for surgery. It
Right.
was
Right.
destined.
You took on the challenge.
Yeah.
Yeah. Yeah. And then the medical device side of things, you must have seen a gap there in the way things were being done to develop what you developed. And what was the first thing that really inspired you to develop a medical device?
Well, it's funny. The first thing I did was actually while I was in medical school. I developed two things while I was in medical school. One was a little journal. We didn't have digital tracking for patients, and so I developed a pocket-sized journal for medical students and doctors to carry around in the hospital. And then I developed a surgical dressing for breast patients that limited the amount of bruising and swelling after breast surgery. So those
Uh,
I did while I was in medical school. I think, look, it's kind of like your career. I think some people just have a connection between the right and left side of the brain, the creative side and the analytical side kind of are connected. And
right.
it's not that common in medicine. Um, but honestly, my career, if you look backwards, looks like it was really well planned, but it wasn't. Most of it was following destiny and just this drive to continue to make people's lives better and leave this world a better place ultimately.
Right. Now that makes sense. I think it's like you say, the more analytical side commonly that's dominant in the medical profession. So the creative side, perhaps not so much. But obviously, you had that going for you, and you saw the gaps, and you started developing things right away. Um, so you had your own experience, though, haven't you, with surgery yourself and with pharmaceuticals, and I guess that contributed in some way.
In a major way. I think
Hmm.
in a major way. Like I said, when I was really young, 14, I had my first knee surgery. And, I tore the cartilage in my knee. It was extremely painful. My knee wasn't functioning properly. And again, surgery fixed that. So it definitely leaves an impression on you. And I've had multiple other injuries from gymnastics, as well as different surgeries that were involved. And I think it's a lot like your journey. When your own health is impacted, you really have to take charge and you have to. I think in the old days, people went to the doctor and the doctor was like a prophet and it was kind of like, yes, doctor, I will do whatever you say. It's just not like that anymore. It's not like that anymore. And I meet
True, that's true.
amazing people like you who explore the gifts that we have on this planet that are so healing. And you really helped open my eyes to explore that even deeper. I always knew that our bodies are like a fish tank.
Yeah.
We are made up of 70% water. And what you dump in there actually makes a difference. If
Yeah.
you put bad chemicals into the fish tank, the fish wind up floating at the top.
Yes. Well, I've heard you mention drug or pharmaceutical overuse. Especially the steroids and the painkillers, which I guess you would see a lot of in surgery as well. So, how does that contribute, do you think, to the long-term cancer risk?
Oh boy. I mean, I think we're finding there's a definite correlation. I think even worse are statins.
Okay.
Um, Statins are given out like candy.
Yeah.
If you go to any doctor and your cholesterol levels are a little bit high, you're going to wind up on a statin.
Mm,
And for all the good that those drugs may do, the risks are fairly significant. Muscle aches and pains, joint aches and pains, memory issues. And there's so much we can do through diet and exercise, as you've shown, and
yeah.
detoxifying the body. That's where I think the future really lies in healthcare. And I've
Yeah.
gotten more and more involved in that side of it. It's really interesting, fascinating to me. I've done that in my own life. I walk the walk.
Right.
And I know you do as well.
So have you made a bit of a transition away from some of the more common pharmaceuticals in practice, and also yourself, perhaps even towards more herbs, nutritional supplements and things?
Definitely,
Yeah.
definitely, definitely. And there is science behind it. It's just not the type of science necessarily that is considered traditional,
Right.
you know.
Yeah. Yeah.
But even traditional science is looking at herbs and supplements and things like that. There needs to be more.
Yeah, I see. I don't know what your perspective is on what RFK and the NIH and are they doing at the moment, but they're definitely starting to look, aren't they, at some of the pharmaceuticals and the toxicity side of things a little bit more, and even some of the studies that are showing bias, even towards the big pharma companies. So I guess that some of that science is coming into question a little bit, isn't it?
I would say yes. I would
Mm.
say my biggest disappointment being in
Hmm.
healthcare for the last 30 years
Yeah.
has been the enlightenment of understanding that medicine is a business,
Right.
pharmaceuticals are a business. It
Yeah.
was it was a real eye opener for me. I just never ever ever thought of it that way, and it was very disappointing. And I think a lot of science is wrapped up in that, in the big business of big pharma, and now we have private equity firms getting involved in buying out hospitals and physician offices, and it's very disappointing.
Right. Right. So caring for the patient is not always the number one priority on the list necessarily, is when developing these products. But um, with medical devices, I guess your empathy and compassion towards the patient is more the driver. Is that the case?
Yeah. I
Yeah.
mean, I got involved in device development because in breast surgery, it was very archaic and there was a lot of room for innovation. So we were able to move from mastectomy and reconstruction, or even saving the breast. But that was on the heels of early detection. So getting mammograms, screening mammograms, finding cancers before you could actually feel them in the breast, being able to biopsy those cancers and locate them. That required all sorts of new technology. And so I was involved in many aspects of the evolution of breast surgery and breast cancer treatment, and it was really exciting. I kind of feel that way right now. I feel like we're part of this revolution of self healthcare. And it really has my attention. It really has my interest. I think with social media, there's a lot we can do in terms of educating people on herbs, supplements, detox, how to take care of themselves, when and if you need um, traditional medicine. But the marriage of East and West medicine is where we're at right now. We're at this sort of pinnacle where we can do so much by marrying the two together. Even music, massage therapy, swimming has been incredibly healing for me personally because I had these injuries from gymnastics. And just yoga, breathing, so many things we can do to really heal our bodies and take care of our bodies. And that has my full on attention right now.
Really, really. Okay, so a bit more on the preventative side as well as treatment. You're moving in that direction with some of the ideas or the things that you've been working on?
I actually have been, and
Yeah.
it's a little strange, but I realized way before COVID happened that the nose is actually a very important part of the human body, right? 80% of all infections and other nastiness comes into the body through your nose. Okay.
Right.
And we have very little protection. The nose is supposed to do this huge job of filtering and humidifying the air and preparing it for oxygen exchange in the lungs, right?
Yeah.
But we do nothing to protect it. Like the mouth is very similar. We have enzymes and all sorts of things to kill the bacteria that we eat in food or that we breathe in. But we brush our teeth twice a day.
I guess it's interesting. I guess people have become a lot more aware since COVID too, that what you breathe in, what you inhale gets, that not just gets into your lungs, but also affects the heart. And
absolutely.
So that whole heart lung system it's almost connected as one, almost in a way, isn't it?
It is one, because the heart and the lungs, the heart, one side of the heart actually pumps the blood into the lungs to get oxygenated, right?
Right.
And then it returns to the other side of the heart, which pumps it to the rest of the body to deliver the oxygen.
Right.
So it's a very intimate system, and it's all connected to the nasal intake of oxygen. But the air is polluted that we're breathing, just like the water that we're drinking. And there are particles that cause inflammation, like allergens and different things people are sensitive to. 40% of the world's population is allergic to things in the air, airborne particles. So it's a massive human healthcare problem. And I realized this years ago, but really didn't have the time to explore it. But now here I am, deeply embedded in the respiratory system, and I've developed a device that we can use every day, even to clean our noses. That's antiseptic. It kills germs and removes particles and helps to moisturize the nasal passage so that we can optimize respiratory health, because it's essential.
Yes. Yeah. So not just for the lungs, the nose, the lungs, but also the heart, the whole system. What happens when those particles build up in the nose and they get into the lungs and the heart? Is that why we get these allergies, or do we become more sensitive over time to things?
That is a great question. So what happens is you breathe it in, and then the particles actually get trapped within the sinuses. Behind your cheekbones are these cavities, okay? And they're rich with a blood supply. It's a wonderful place for bacteria to grow. Wonderful. So when you catch a cold or the flu or COVID or whatever, it enters the nose. The nose tries to react as best it can. It traps some of it in the hair and the mucus, but if it translates into the sinuses, it can grow there and multiply, ultimately going to your lungs. That's why a cold starts in as a head cold and becomes a cough, right?
Right.
Because they're connected.
Right. So it moves from one
Right.
place, one area to another area and goes deeper into the body. Is that the
Correct.
process? Right.
Yes.
Yeah.
And so you want to nip it in the butt. You really want to start by cleansing your nose every day. I think it's a really great habit to have. I do it for sure. There's no reason not to do it, right? But it's kind of obvious, but nobody thought of it before.
Is blowing your nose not enough?
No,
No.
it's not. Blowing your nose will help to get some of the mucus out, but it's not cleaning your nose, and it's certainly not killing any germs that might be there,
Right.
right?
Yeah.
So, and of course, you'll never prevent everything because some of what you breathe in is through your mouth, some is through the nose. Most of it comes through the nose, but we have to do a better job of taking care of our respiratory system. I like to say it's time for the nose to, get some respect. It's,
Yeah.
it's just been overlooked for so long.
Well, I actually noticed a lot of people that during the COVID masking, when everyone had to wear masks, and they didn't cover their nose. The mask was
Yeah,
over the mouth, and
yeah, that's
how
silly.
pointless. Yeah, complete waste of time, wasn't it, to be wearing a
Totally.
mask?
You know what's interesting? We always look back at history. I'm sure in your world of herbal medicine, you look back a lot to see what early mankind used to help with different ailments.
Yeah.
The truth is, if you look back at the history of the nose, in ancient times, the nose was so revered because it indicated your family connection, which might have been royalty. And on certain statues, if you look back, all these ancient relics, all of them are missing their nose. And I think that's so peculiar, but not, because what they did, they actually removed the noses on most of these statues because they believed that that would restore life to the person or the soul that actually died. So a lot of times the enemies would come in and remove the nose on those statues, which
Wow.
I just find that fascinating.
I guess the Sphinx is an example too, isn't it?
The Sphinx is a great example.
Yeah.
Definitely.
I mean, you often see it, but you don't often think, why is that? Is it deliberate? And you're just shedding light on it. Wow.
That's just one of the things I've learned on my journey up the nose.
Yeah. And so what sort of, do you get pathogens, or is it just dust or bacteria, or what sort of things build up in the nose?
It's all of the above. So it's germs, it's particles, it's dust mites, it's dander from your pets, it's what we call VOCs, volatile organic compounds from the exhaust of cars.
Right.
It's pollution in the air. It's salt water when you're out swimming in the ocean. God only knows what's in the ocean.
Yeah, that's true. And
we just need to keep it clean.
And you can't easily clean it with, with water or with any kind of liquid. It's quite hard.
You can rinse the nose, obviously saline rinses, but they actually bypass the entrance, the nostril, where the hair is. They bypass that and they shoot water up one side and it comes out the other side because it's connected in the back.
Oh, okay.
There's a connection. It's open.
That's like a pump or a bottle or that you put up there and pump the liquid in.
And it's actually very popular because people are suffering. There are so many people suffering from sinus congestion. They can't sleep. They think they're sick, right? They think they have a cold, but really it's inflammation.
Right.
It's chronic inflammation from junk in your nose.
So what other symptoms might you experience that'd let you know that your nose is a problem?
Well, you can have a lot of buildup, crusty buildup in the nose, and that's from mucus. What happens is the nose and the sinuses produce mucus to try to combat the onslaught of stuff that's coming into the nose. And a lot of times you'll see people picking their nose, which is a terrible habit, not only because it looks bad and it's obnoxious,
Yeah. Yeah.
but your fingers have a lot of bacteria on them. And so when you put your finger up into your nose and you pick the dry crust, you can cause little micro tears inside the nose and introduce bacteria. You can cause an infection. So the nasal science is kind of an embryonic area of medicine, and certainly in self-care. It has really been it's such a huge opportunity for innovation, and that's kind of why I got interested in it.
Okay. So tell us more about what you've developed. We've been holding back a little bit. Yeah.
I have developed a device for cleansing the nose. It's like a toothbrush. It's a product that is called Nasal Cleanse. Very simple name. And let me grab one.
Yeah. Let's have a look at it.
It's called Nasal Cleanse. It's really very simple little device, and it's really comfortable. It's soft, right? So this bit is anatomically designed to fit inside the nostril, and you can't really push it up too far. It's very comfortable, and the leaflets that rotate around in there help to spread the cleansing gel and help to get the crusting out of the nose. So it's dual action on the leaflets, and then you can wash this with soap and water. It's just literally like a toothbrush.
Okay.
And then we have a.
Do you have a particular solvent on there, or does it come with it? Yeah.
Yep. It comes with a gel that we developed. Nasal Cleanse. It comes with this gel, and you just put a little bit of gel on the tip here, which it's a clear gel. We have unscented, and we do have a mint, which is really nice and refreshing. And off you go. So it literally takes less than 30 seconds to clean your nose. And it's something that I do at least twice a day. If I'm on an airplane, absolutely. I usually do it every 4 hours at least. And you can feel it moisturizes the nasal passage.
That's
you don't
amazing.
need a lot of the gel.
It looks like a toothbrush, like you'd brush your teeth and brush your nose sort of at the same time. Is that the idea?
Yes, the idea. You just leave it in the bathroom, or you take it with you. And, we're an early company where you're going to see a lot more evolution of our products coming out with travel cases and things to make it convenient. We have individually wrapped packets that you can take with you. You can take it to school, and a couple different configurations of the product. And so far, we've had over 50,000 people try the product. We've had, we've had phenomenal feedback. We track all complaints, which is really important to me because we want to make sure we've designed a really useful product that people like, that's easy to use. And our complaint rate we're very proud of is only 0.09%.
Okay.
Very low, very low. The US and New Zealand are the only two places we have it available right now.
Oh, wow. We're very lucky then. We'll make this available, let people know that they can get it here in New Zealand, and share the link for people to have a look. What do you think the biggest thing is that you've learned about the gaps that are there in the market for innovation and patient care, and what's really still available there? What options do you think are still open for you in that area going forward?
Well, there is a plan for that. Similar to the respiratory system, there's a lot we can do in women's health, which is, where I've spent most of my career. There's still a lot more work to do in women's health. And I think a lot of that goes back to the work that you do, because with the population, so many people having metabolic syndrome and, fighting that trend towards obesity. Okay.
Yeah.
What happens is the pH of the fish tank that we were talking about, the pH of the body gets really screwed up. And that messes up lots of different aspects of the body. But in women in particular, vaginal health gets really messed up with diabetes, type 2 diabetes, with just imbalance. You get overgrowth of yeast, and it's very common, as well as bacterial vaginosis. So this is another area of interest that I see can have a major impact on people going forward. And we're doing some work in that area as well. But it's got to be coupled to diet, exercise, nutrition, and balancing the body.
Yes, yes. So the holistic approach is part and parcel of the whole thing. You're cleaning our bodies on the inside, cleaning them on the outside, cleaning the cavities and orifices, I guess, in a sense, the things that we don't often think about.
Exactly.
Yeah.
We think, in medical school, they teach us, oh, the vaginal area is like a self-cleaning oven. No, not.
Yeah.
It similarly is bombarded by lots of different things, germs.
Yep.
For sure. And if the pH is off, it's prone to infection. And those infections can spread to the pelvic organs, to the uterus and the fallopian tubes, and cause pelvic inflammatory disease, which is a multi-billion-dollar healthcare problem in the United States. Can cause infertility. Yeah. So I think what you just said is the most important thing going forward. And that is helping to educate people about their own health and what they can do, empowering people to take better care of their bodies, because you only get one.
That's right. I guess we think of our cars, needing to be serviced every few months, and they get dirty on the inside as well, don't they? We don't, our body is much the same. A vehicle that's just going to pick up, waste and debris and accumulate just general dirt and grime on the inside, on the outside, all over the place. And having a shower or a bath is not enough, is it?
It's important, but it's definitely not enough. I think it's this realization that we do need a holistic approach to prevent problems from happening. Traditional medicine and surgery in particular is a problem-solving game. It's like people present with a problem and then we have to fix it.
Right.
It's much more efficient and cost-effective and better all the way around if we prevent those problems. So I think preventive medicine, self-care, empowering people with education on their bodies, how their body works, why it's important to eat certain things and not eat other things. We can change the way society looks just by what we eat.
Right. And what you're providing there is a tool, really. I guess giving people the tools they need to do the job and being able to take care of themselves in a more depth and more detail is going to be part of that picture, isn't it? It's
definitely
a great job you're doing. I'm looking forward to what comes next as well. That's it's exciting. I guess you're one of those people that just keeps moving forward with things, and it sounds like you've had over 50 devices or patents. How many devices have actually patent? How many have come to market?
I don't really know how many. Well, all of those patents are generations of the different products. So on each product, we continue to iterate the products, and that generates more and more intellectual property. Right. I've started 8 companies. Within each of those companies are multiple different products. This is my 9th one. But we have multiple products in this one as well. So it's one of those things. It's a blessing and a curse, as you know. It's
Yep.
you know, it's just me. So it's a little bit weird.
Yeah,
But
yeah,
I definitely fall into the classification of a workaholic, but work is my life and I love it. And that's all that matters, really.
yeah. Well, you're an amazing lady and very busy lady as well, I guess.
Oh, thank
So
you.
really, really appreciate the time you've taken to join us and to share what you're doing. And
Likewise.
I'm sure
I've
that there'll be some interest out there for the naso cleanse on our end of things with people watching today. So
Thank you, Brett.
thanks so
And
much, Gail.
keep doing what you're doing because um, I think you were way ahead of the game. I know I've used your products and love them. During some of the health issues that I had myself, I love the little sachets that you had, for the body cleanse. And I think they're just wonderful products. And you can tell they're all natural. And those are the things we need to lean into.
Yes,
So I've appreciated, your friendship and you educating me on so many things over the years, and staying in touch has been fantastic.
yeah. You too, Gail. I will talk again. Well, I'm sure we'll have something further to talk about in the future.
Sounds great.
Yeah.
Thanks, Brett. Have a
Thank
great